everyone. My name is Dr. Vaidehi Desai Shah. I'm a consultant robotic gynecologic surgeon and an obstetrician and an international faculty for obstetrics and gynecology. So today this is going to be the first series on my official YouTube channel, Dr. Vaidehi Desai Shah's Obstetrics and Gynecology. That is the name of my YouTube channel. Do like, subscribe and share to this channel and be updated with the evidence-based obstetrics and gynecology. And this is going to be a next level obstetrics and gynecology. This is a very useful channel for the undergraduate MBBS students, postgraduate students, as well as the NEET PG aspirants and the practicing clinicians as well. Because in this channel, we are going to discuss all the live updates and evidence-based guidelines and all the recent guidelines in obstetrics and gynecology. So you can also join my FB page, and if you have any valuable queries or discussion, you can put it on Dr. Vaidehi Desai Shah's Obstetrics and Gynecology Discussion Forum. That's the name of my FB page. Okay, so let's begin our first episode of COVID Diaries in Obstetrics and Gynecology. All right, so I am coming up with a short case with a short MCQ on COVID, right? So this is a very trending topic, and this topic is very high yield for your upcoming exams. All right, so please understand the clinical based questions that can come from COVID scenarios in obstetrics and gynecology. So here we have our first patient, Mrs. Naira, a 26-year-old female, a nulli gravida, who has been married for since 6 months, right? She misses her period and seeks telephonic consultation at gynecology clinic. She was advised to do a urinary pregnancy test at home. Her UPT result comes out to be positive and she is currently pregnant. So according to the ICMR guidelines, the recommended number of antenatal visits during the COVID-19 pandemic is option A, 2, option B, 3, option C, 5, and option D, 4. All right. So if we look at this question, basically this is a patient, she had sought a telephonic consultation. Now you see, COVID has caused a revolution in the practice. Right, the traditional practice of obstetrics and gynecology is always that we recommend the patient to come to the antenatal clinic and get the examination done by the nurses and the doctors, isn't it? But this COVID has brought about a revolution in the practice of obstetrics and gynecology. So there are certain things that can be managed by telemedicine. So if the highlighted orange colored are the antenatal visits, which can be managed by telemedicine. They include the virtual prenatal care visits, home monitoring of weight, blood sugar, fetal heart rate, and blood pressure, consultation with other specialists who are related to obstetrics and gynecology, like maternal fetal medicine experts, genetic counselors. These are during the antenatal checkups, right? During the pregnancy, after the pregnancy, that can be lactation support, and virtual postpartum visits are also a part of telemedicine checkup, right? And supporting the patient, giving the mental support and mental health care assistance can be done during pregnancy as well. So, all right. So these are the things which can be managed by telemedicine. Now, ICMR has published guidelines. And according to the ICMR guidelines, that is the Indian guidelines, at least a minimum of 4 antenatal visits are recommended for pregnant patients during the COVID era. So you know that the WHO had recommended at least 8 antenatal visits. All right. Cutting down to 50% of those visits are advisable in the COVID era, right? Because it's a pandemic era and we try to do the social distancing and we try to avoid, we try to reduce and cut down the exposure of the pregnant woman with a social healthcare worker, as well as vice versa, right? So according to ICMR, 4 antenatal care visits are recommended at 12 weeks of gestation, at 20 weeks of gestation, at 28 weeks of gestation, and at 36 weeks of gestation. So these are the guidelines according to the ICMR. But the guidelines for FEMU are a bit different. FEMU is a federation of the International Society of Gynecologists and Obstetricians. According to FEMU, a minimum of 5 antenatal visits are recommended. And what are the times when these visits are recommended? So if you look at this, at 12 weeks, they recommend a genetic screening visit, right? At 20 weeks, anatomical scan and review visit is recommended. So this visit is very, very important because we advise this patient to undergo a targeted scan for fetal anomalies and review it so that we can screen for any chromosomal or structural anomalies in the fetus and can take appropriate decisions accordingly. At 28 weeks, gestational diabetes mellitus screening must be done. Also, if a woman is Rh negative, anti-immunoglobulin must be administered at 28 weeks. And as you know that all the recent guidelines like ACOG, RCOG has recommended that Tdap, that is tetanus DAP, immunization must be done during every pregnancy at 28 weeks. All right. So at 28 weeks, 3 things must be done: gestational diabetes mellitus, anti-immunoglobulin, and the third is Tdap vaccination. All right. 32 weeks visits must be done. Just to make sure that the fetus is growing properly. So that can be a growth visit, as well as we can also monitor all the various parameters of the pregnant patient with COVID, right? During the COVID pandemic. At 36 weeks, GBS screening, that is group B streptococcus culture screening, must be done. And finally, at 38 weeks, the last visit is recommended as per FEMU. This will help in the delivery planning and the pregnancy scheduling, right? So now, if a patient is having COVID, if a patient seems to be symptomatic for COVID, how would we reschedule her antenatal visit? Remember that any symptomatic pregnant COVID patient must defer appointment for at least 1 week from the start of her symptoms. So at least 7 days, we will ask the patient that her appointment must be postponed. All right. If a woman is already in the self-quarantine period, then that female must defer appointment for 2 weeks. All right. And if an ANC visit has already been postponed for more than 3 weeks, then she must be contacted by the ANM or the ASHA worker. All right. So this is something which is very, very important, and these are the guidelines from ICMR. All right. So with this, thank you for your patient listening. I will end the session and I will end the first episode of COVID Diaries. And this is something that I am coming up with a short series which will help you to understand the COVID scenario and the practice in Obs and Gynae. So do like, subscribe and share to my official YouTube channel named Dr. Vaidehi Desai Shah's Obstetrics and Gynaecology. You can also join my FB page, Dr. Vaidehi Desai Shah's Obstetrics and Gynaecology Discussion Forum. Thank you. Good luck.